Welcome to the fourth webinar of our 2021-2022 series. Today, I'm up and I'm going to be leading this webinar on how to explain diagnoses to kids. I am Mandi White-Ajmani. I'll introduce myself a little bit more fully in a minute. I am joined today by our therapist extraordinaire, Jill DiPietro. She's going to join in after this talk to help us lead a question and answer session and a conversation about how to explain diagnoses to kids in a successful way. So I'm Mandi White-Ajmani, the owner of Small Brooklyn Psychology. We are a psychology practice in Industry City in Brooklyn, where we offer therapy and neuropsychological assessment to people of all ages, all backgrounds, and all psychological concerns. So you can see all of us there at the bottom. That's me on the left, then Natasha Brown. There's Jill DiPietro, Sam Janit, Deidre Edwards, Nav Gill, Ben Janitis, Maddie Lawler, and Danielle DeFilippo. We all have experience working with people across the lifespan, but we also have special training and experience to do assessments and treatment with children and parents, even down to babies and toddlers. It's remarkable what some of the things that you can do. As I said, this is our fourth webinar in this year's monthly series. Recordings for all of our previous talks from last year, as well as talks from earlier in this year, they're all on our website at smallbrooklyn.com/services/talks. We cover a lot of ground in those webinars, from tips on managing behavior at home and in a classroom, to what a neuropsychological evaluation is and how it helps you, to how to understand mental health issues in children and adults, and then also just how to take care of yourselves as parents, because it's a really hard job, especially now. Our next webinar next month will be on February 9th, where our newest team member, neuropsychologist Dr. Danielle DeFilippo, will talk through all the different kinds of evaluations that you can get. People say sometimes you need to go and get a psychoeducational evaluation, you need to get a neuropsych evaluation, you need to get a forensic evaluation. Well, what are all of those? Are they really that different? And when do you need to get what? Also, what's the difference between an evaluation that you might get from us versus one that you might get from the Department of Education? So registration for that talk is going to go up in a couple of days, so keep watching for it. This series has been media sponsored by Park Slope Parents, and we're so grateful for their support. They are our amazing local community resource. If you are a parent in Brooklyn and you're not on Park Slope Parents, I really recommend checking it out. They have so much support for parents and families and kids, career support, emotional support, friendships, meetups, and they've just been super helpful even for me personally and my family, as well as building the practice. Now, during this talk, if you have questions, type them to Jill in the Q&A box. She's going to be monitoring them. And then we're going to come back together for a conversation at the end of the main talk. Excuse me. All right, so now just to describe my background, I am a clinical psychologist with extensive experience in neuropsychological assessment of children and adults from many different backgrounds. I have my BA in psychology from Cornell. I have an MBA in organizational behavior from Suffolk University in Boston, and I got my PhD from clinical psych from Suffolk as well. While I was at Suffolk, I was very fortunate to get a lot of informal mentorship from Edith Kaplan, who is one of the great women pioneers in neuropsychological assessment. And even though I didn't know at the time that I wanted to do neuropsych assessment full time, she just gave me this amazing look at how she conceptualized the brain and all of its nuances. It's because of her that I came to understand all the interconnected dynamics that exist between a person, just in the person's whole system, how somebody's idiosyncrasies can really are shaped by the context that they're in, and also shape the context that they're in, and then how to flexibly measure and communicate that. So it was a tremendous education. But I started my career in neuroscience research because I thought that I wanted to do all of that at a population level to really understand patterns across people. I did my postdoc and a research assistant professorship at NYU School of Medicine and worked with labs there as well as at NYU proper. But as it turns out, I really didn't want a grant application hanging over my head for the rest of my career. It's a hard field. So I left and I started Small Brooklyn instead, and it's been a tremendous decision. It was just me doing neuropsych assessment from 2013 to 2018. And I didn't realize it until I started it, but really neuropsych assessment is just a research project, but with a sample size of one. And it really gave me a chance to work directly with a family and see the impact that I had on that family, and then the next family, and then the next family. So it's been wonderful. I expanded to a group in 2018, and we have grown so much since then. And then Jill DiPietro joined us in 2020 at the height of the pandemic. I didn't actually even meet Jill in person for like a year, I think, a year after she started. It so such weird times that we live in, but I'm so grateful that she joined us. It's been so awesome to have her. So she is a licensed clinical social worker who specializes in the diagnostic evaluation and treatment of children and adolescents with ADHD, disruptive and oppositional behaviors, selective mutism, autism spectrum disorder, anxiety, and many other behavior and emotional issues. She has extensive experience in providing evidence-based treatment, things like parent-child interaction therapy, which is a very effective but specialized treatment, an adaptation of PCIT for selective mutism, parent management training, which is PMT, and cognitive behavioral therapy in all its varieties, as well as social skills training. And she's also been really generous in sharing her knowledge too. She gives multiple webinars to the community. Thank you very much, Jill. And also does a lot of supervision, including Maddie Lawler, which is another one of our amazing therapists, as well as some of our externs, our doctoral externs too. Also, Jill, you've really become my go-to person when it comes to like having to decipher any sort of dense policy or anything that needs attention to detail. So thank you very much for that too. All right, so in her long experience as a therapist, Jill has had a lot of opportunity to help explain diagnoses to parents and kids. So she creates her own assessments and makes diagnoses. She also has to digest assessments from other people, talks to a lot of other providers. And, you know, as part of that is sometimes often is the first person to really explain a diagnosis to a kid and what that really means, helping families to understand it, not only at the outset, but then also how it evolves over time. So she's going to be a really great resource for this conversation as well. All right, so I'm going to dive into the talk here, and then Jill's going to turn off her camera, but she's going to be monitoring the Q&A box, and she'll come back in at the end to help me answer some of your questions. Okay, so we're going to talk about the basic question first. You know, we have this talk about explaining diagnoses to kids, but really the very first thing we need to ask is, should we explain a diagnosis to a kid? Say you've just gotten a diagnosis from a clinician who's working with your child. Should you share that diagnosis with them? Well, I think you could probably guess I'm going to say yes. But parents have a lot of concerns about this. Some of the things that I hear on a regular basis are, will kids be able to understand the diagnosis? Will they think that there's something wrong with them? Will they use it as a crutch? Will others use it to pigeonhole them? And then are they going to be defined by this? Will this diagnosis become all that they are? And, you know, really those answers are, the answer to that is no, but also yes, to some extent. And let's talk about that. So I do think that you should share diagnoses primarily for education and advocacy. And it's important to share them in these expanding circles of influence. First, the child, then the immediate family, then the community. And so each of those rings has an opportunity to be educated and to and for the child to find advocacy in those different ways. And so we're going to talk about all of that. So let's talk about labels. You are worried that people, including your child, will use this diagnosis to define who they are. But there's nothing inherently wrong with a label. It's really how you use it that matters. At its core, a diagnosis is the best description that we have for the pattern of strengths and weaknesses that we see. Giving kids the vocabulary that describes what they're already feeling is actually really empowering. And that's a critical point that I'm going to keep coming back to. Giving them this vocabulary, this label, it doesn't create the problem. It only describes what the child has already noticed in themselves, even if they're not fully aware of it, and even if they're not willing to talk to you about it. And when you can name something, you can communicate about it. You can compare and contrast with others. You can start identifying nuances in your experience because language gives you the power to do that. That's why it's really powerful. So yes, a diagnosis is a label, but no, it does not contain the entirety of who your child is. Our diagnoses in psychology in particular are very deep and wide, and they can play out to be very different in different kids in different contexts. So it's really important that your mental health provider, whoever assigned this diagnosis in the first place, helps you to understand what that diagnosis means for your child. And please don't be afraid to push that clinician to make those explanations, and keep asking questions until you really feel like you know what it means inside and out. It's pretty common for me to have somebody who has talked with somebody else first in a child's life, who's given them a diagnosis, but then they really didn't know what that meant, and certainly didn't have information on how to explain it. So you should always feel free to ask those questions, and certainly we're here to answer those questions too if you haven't gotten answers before. But it's just really important to remember that a child's diagnosis cannot capture all of the things that make them a wonderful and unique human being. But it can help you to understand how your child is processing the experiences they're having. Parents worry that a diagnosis is going to change how kids see themselves and lower their self-esteem. But like I said before, kids almost always already know that they have certain struggles, even if they're not willing to talk about it. And they've often created a narrative to explain those struggles. Sometimes that narrative is harmful. So what I have found is that the opposite is true. Rather than making them feel worse about themselves, it instead gives them an explanation that reduces their fears and their blame of themselves, and helps them to better understand and accept themselves. In our psych diagnoses, there's usually no physical marker to tell people that a child might have special needs. And in fact, many of the Brooklyn families who come to work with us, a lot of them have signals that suggest the opposite. Parents are usually pretty successful, so why wouldn't kids also be the same? They have access to a lot of resources, so why aren't they using them? A lot of kids are obviously bright. A lot of them come to us with really large vocabularies, really strong verbal skills. And vocabulary is a marker that a lot of people use to assume functioning ability in a person. So if you have a child with a really strong vocabulary, then your automatic assumption is that they are functioning very well in life. They're very intelligent, but also that they can do a lot of things. So a strong verbal skill can actually mask problems. Also, there's the sense that like kids are happy, right? What do they have to be anxious and depressed about? They don't have to pay bills. They can just play at the playground. So there's no reason for them to be having problems. So when when a kid struggles academically or can't control their behavior, the default assumption, and we all do it, even those of us who have been in mental health field for a long time, a lot of times our first knee-jerk reaction, especially when annoyed by a child, is to assume that there's something inherent in the child that is making them not want to follow instructions. And a lot of times our default reaction or our coping strategy is to get bigger and more intimidating, and sometimes to blame the child. A lot of times people will think that a child is lazy or defiant as explanations for why they're not doing what they're supposed to do. They might blame you, the parents, for bad parenting. You might blame you for bad parenting. I certainly hear that quite a lot too. Parents feel a lot of guilt and shame as if they've caused this in their children. And then all of that narrative, it filters down to the kids. And it shapes the kids' own narrative about why they do what they do, because they don't know. They just know that they are acting and they're often getting into trouble. They don't know why, so they're trying to create a narrative for it. They hear, use your brain, and they think, oh, maybe my brain's not up to this. Maybe I'm just stupid. They hear, you can do this, you just don't want to. And they think, I must be lazy. They hear, just be good. And they think, I don't really know what that means, and I don't know how to do what they want me to do, so I must be a bad kid. And over time, they hear this criticism over and over, but they're still struggling. They might be trying really hard to do what you're telling them to do and to live up to those expectations, and they just can't because they have skills that have not developed yet. And so after a while of trying really hard and getting them nowhere, they sometimes just give up. They check out. Maybe they start to be bad kids to match up with the narrative that they already have in their head. Maybe they just feel like they're always screwing up. And unfortunately, that narrative leads to some of the troubles we see, the really difficult troubles: depression, anxiety, extreme avoidance, addiction, rule breaking, self-harm. So it's really important that we do our best to stop this narrative starting or from becoming more entrenched. So understanding a diagnosis and what it all means, that can cause a really huge shift in how others see your child and how your child sees themselves. I'm sorry, my page down is not working very well. I tend to see a lot more understanding and acceptance and support when diagnoses are communicated. Expectations change, and judgment goes from criticism of what the child was doing wrong to now cheerleading and praise about things that they have been able to accomplish, even when it's hard for them, and even when it is something that another child can do easily and intuitively. They now have better understanding about why your kid is having trouble with that. So there's a lot more compassion and acceptance and patience that comes about it. And that attitude shift just makes such a huge difference. And it changes your own attitudes too, as parents. You tend to have less guilt and less worry that this is something that you've caused. You tend to have more patience for your child. There's often less frustration and anger, not that it disappears altogether, because it can be really hard. And you need to give yourself some grace for that. But it's easier to have more acceptance that your kids are not doing it on purpose to drive you crazy. You also have more access to all of the clinical knowledge that's out there. There's a lot that we don't know about mental health disorders and why they happen, but there is a lot that we do know too. And there's so much knowledge, there's so many programs, government support, school programs, support groups, treatment providers. So if you have a better sense as to what you're looking for, you can find these things if you have more guidance on where to look for it. And then all of that attitude shift, that filters down to your kid too. So often what we see is not dread or fear of a diagnosis, but relief. They start realizing that they're not stupid, they're not lazy. There's a name for what they've been going through, which critically communicates the information that they're not alone in this. They're not some weirdo that is the only person in the world that is experiencing this problem. In fact, there are enough people who have the same pattern of strengths and weaknesses that I do that they gave a name to it. And then in turn, they express more understanding and acceptance of themselves. And they're more ready to accept treatment strategies too. They can understand more about why they're doing all of these therapies, and that can help them to commit to it. Okay, so I hope that is a good, convincing argument for sharing the diagnosis at all. So now the bigger questions, I suppose, that we're going to spend more time on is when should we start talking to them, and how do we do that? That's the big issue. All right, so when do you start sharing this information? I say right away. Even before kids can fully discuss it with you in a sophisticated way, you can talk to them in developmentally appropriate language that will help them to understand, even at a very concrete level, that their brain needs things to be in a certain way and that they can do some things to help themselves. So there's some argument that says that it's better for kids to understand all of their differences, especially in the context of somebody else's differences and this person's differences. Everybody's a little bit different. Using that language over and over again, even from a very young age, helps to normalize all of this. But helping them to understand that there are differences before they really become aware of it for themselves, because then once they've started noticing differences in themselves, they've already started creating that narrative. So the sooner that you can head that off, the better. And so for each kid, it's just going to be a little by little experience. When is your child ready? How much can they handle right now? How can you present it to them in ways that they can understand it right now? And remember that this is not a one-time conversation. This is something that you're going to talk about again and again and again as the child develops, but also as new situations present themselves, as your understanding and their understanding of themselves changes over time. And they and you will also be able to take in more as more life experience happens. I also really encourage parents to reread if you get a neuropsych report, to reread that report every year or so, because you'll probably see more things that apply to your child now that maybe weren't as obvious or salient back then, but now is really important. Okay. So how do we explain these diagnoses to kids? I'll spend most of the rest of our talk talking about this. And the foundational important part is to help them explain it in ways that they understand that they are not broken. There are different patterns for different people, and the vocabulary and the language that we're going to be using is a way of describing those patterns, not talking about all the things that are wrong with them. You know, when kids come to my office, I talk about what a brain is and what it does and how every brain is a little bit different. We talk about differences between the kid and me. So for example, I'm left-handed. My favorite color is red. I can sing, but I really can't draw. And we talk about the things that they can do easily. What comes easily to them? What is something that they can do without really even having to think about it? And then what are some things that they have to work harder to do well? And those things exist in every person, and they're different in every person. That's part of what makes us so unique. So we're going to talk to them about what comes easily and what they need extra help in. And so this set of patterns is true for every diagnosis. There's a common typical pattern that you see in a particular diagnosis that has strengths and weaknesses associated with it. It's important to help your child see both of them. Dr. Liz Angoff has created a framework that I really like for sharing diagnostic information about kids, with kids. She talks about strengths as highways and weaknesses as construction zones. So highways, you might say, here's where the connections in your brain are already super strong. The messages can zip down the connection super fast, like a highway. But in a construction zone, and everybody has them, highways and construction zones, some connections are just forming. There are some things that you haven't learned yet, or maybe things that you really just learned, and some things where that road is not totally built yet. These skills are still under construction. So for now, it might take a bit longer to get where you're trying to go. I think these are great metaphors, and she has a lot of great kid-friendly handouts describing all the highways and the construction zones, as well as helpful words, which is the diagnosis and some vocabulary that goes with it. And also the section on who's on your construction crew, which is basically a way of introducing treatment providers and supportive people. There's a ton of resources for both practitioners and for parents on her website at brainbuildingbook.com. And she has also just finished a Kickstarter for publishing this book, Brain Building Book, which is a way of explaining the assessment process to kids and helping them get a ton of information out of it in very digestible ways. It's a great system, and we're going to start using it here at Small Brooklyn as well. So I'm going to keep using this language because I love it, highways and construction zones. So I'll keep bringing that up. But I think it's a really nice metaphor for you to use if you are also explaining your things to your child too. Whatever metaphors you use, the critical points to convey are that your child is valued. They are not alone. They can learn some strategies to make some challenges easier. And that learning about themselves is going to be a lifelong process. Even as adults, we have our next construction project, the thing that we're working on for ourselves. And this helps to normalize construction zones for your child. So instead of talking about what's wrong with you, you can say, what's your next construction project? All right, so talking about explaining all of this in developmentally appropriate ways, what does that look like? For kids under 4, it's important to talk really concretely. You focus on behavior. It's what they can most connect to. It's the things that they see, that they remember. So for example, you might say, when a sound is too loud for you, you cry. We're going to try these headphones. This way, we can see the fireworks and it won't hurt your ears. You might also say something like, I know you want to play with Jackson, but he might not know that. When you look at his eyes and share your toys with him, that will help him to know that you want to play. So it's very simple, it's very short, it's very focused on behaviors and concrete things that they can do. Excuse me. All right, for kids from 4 to 7 years old, they are able to understand, but it's best if you talk to them about it given their own experience. So focus the discussion on the diagnosis as they experience it and talk about the specific traits of the child and keep it simple. You might say, your teacher wants you to read, but you have trouble paying attention to the book. That's because even though your brain is great with pictures, it has a harder time remembering letters and words. Let's see what graphic novels we can find to put those two skills together. The pictures can help your brain remember the words better. Here's another example. You want to be friends with Thomas, but he gets mad when you touch him all the time. Your brain gets so excited about playing with him that you have a hard time stopping yourself sometimes. We're going to learn some ways to build up your brain brakes so that you can get better at stopping. And then you can also start mixing in some self-advocacy into this as well. So helping them to learn about themselves, but also to share what they know with others and what they need. Creating an All About Me book is actually a really nice way of doing that. There's a few different ones available that are already printed, but of course it's also really easy to just staple some pages together and maybe you write while they draw. But you can talk about all the different things that make your kid a wonderful, unique person that also include some of the patterns of behavior that you see in their diagnosis. So what are their likes and dislikes? What are the things that make them awesome? And then what are the things that they have some challenges with? And what are the construction zones? What are the things that they're working on next? That's something that if they want to communicate that information to their teachers, to their grandparents, it's a nice packaged book that they can take and present to somebody else. And they can have that ownership of something they have communicated to you. For slightly older kids, kids 7 to 12, first, listen to their experiences in their own words and ask them what their hopes and wishes for themselves are. It might be different from what your hopes and wishes are for them. So maybe you want them to be able to sit down and finish their homework without, in a reasonable amount of time. They just want you to stop yelling at them about doing their homework. So you can use that motivation of, I want my mom to stop yelling at me, as the impetus for the next construction zone that you're going to work on, and some of these strategies for getting through it faster so that your mom doesn't yell at you. And then you can use the words that they have said to you to explain the patterns of highways and construction zones to them. Now, at this age, they can better understand their diagnoses, of that how diagnoses affect different kids at different ways. They're better able to understand this than they were at younger ages. So reading about kids with similar patterns can actually really help. You can read books with your child and then draw comparisons to them and to their own strengths and weaknesses. So for example, wow, Percy Jackson has ADHD too, just like you. He had a really hard time paying attention in class, but he was actually really good at noticing all these things happening around him, wasn't he? You're looking at both the strengths and the weaknesses of ADHD. Or, that Emily in your class told you that she's autistic too, but she has different highways and construction zones from yours, doesn't she? What are some of the different things you've noticed? Do you have some of those same construction zones too? And then another aspect of self-advocacy for them, for this age group, might be creating a study guide. Yeah, you can create sort of like, rather than an All About Me book, although that is awesome too, you can still do that for this age. You might create more of like a study sheet, a cheat sheet to like who I am, and that can function the same way, but might be a little bit more concise, but it's something that they can still present to other people if they want to. All right, and then we're talking about kids who are 13 and older. These guys are more ready for sophisticated vocabulary and discussion of nuances. They can understand that they might feel comfortable and easygoing with friends and family, but they're going to have a much harder time in an unfamiliar place. And then they can get better at predicting when they have an upcoming situation that might pose a problem for them. And then you can talk with them about different strategies that they can have ready to go if they find themselves in that situation. So for example, taking the SAT in that big room of other kids is probably going to feel like a lot of pressure, and your anxiety might really kick in. let's visualize what it might be like so we can practice some calming strategies. And then for some further education and self-advocacy, kids can research and report on specific aspects of the diagnosis, maybe for a school project, or maybe they can start their own memoir. It kind of depends on what their interests are. They can make a TikTok series or a YouTube channel. They can interview other kids with similar diagnoses and talk about the things that they have in common and some of the challenges that they've had. Gives them, again, a little more ownership over what's happening with them. So now some more of these concerns that parents sometimes have when they are talking about explaining diagnoses is that kids might use a diagnosis as an excuse or a crutch for why they don't have to work on the skills, I guess, or that they will never be able to develop these skills because of the diagnosis, so why bother trying? So it's just really important that you're always bringing it back to the strengths and the weaknesses. So you have to emphasize the highways as well as the construction zones. And when you're talking about the construction zones, make them remember that these are not dead ends. They are connections to be strengthened. And that can happen. And that's the language that we're using. You can teach them how to pause and think through problem-solving strategies so they can feel able to help themselves. And you can adapt tasks that they have to do to their level, so you're not putting them in an unwinnable situation, and help them to do that for themselves as well. Put themselves in situations where they are a little challenged, but they can still get through it okay, and give them the tools in their ready to go toolbox so that they have ideas of what to do in case they start to panic. Another concern is that kids can become preoccupied with their diagnosis and they just want to talk about it all the time. They want to share it with everybody in the world and they don't have a lot of boundaries on that. So, anytime that you are discussing any sort of difficult topic, it's important to try and keep emotion out of it as much as you can. Try and talk about these issues all the time in a neutral, matter-of-fact tone of voice. That really helps with the normalization too, because it's not something to be ashamed of or to get emotional about, but rather something that is just the way that it is. And here's your pattern, and then here's this other child's pattern. And it's just like talking about the clothes that somebody wears, or at least you can present it in that way. But if a child has an obsessive focus on this issue, try to understand why and what they're getting out of it. So if it is something that they enjoy talking about, it's really a new obsessive fascination about it, that's great. They can do all the education and research on it, and they can teach you about it, and they can teach other people about it. If it is something that is preoccupying, though, that's creating worry, well, then we can treat it just like any other worry. And a lot of times one of the first steps is to help to put some boundaries around the worry. We talk about having worry time, where kids have maybe 10 minutes to really allow themselves to immerse themselves in the worry, talk about it as freely as they want. But then at the end of that 10 minutes a day, you put it away in your worry box, it's a mental worry box, and you make yourself not think about it or talk about it for the rest of the day until the next day when they know that they're going to have another 10 minutes to worry about it then. So this is all focused on talking to your child. Let's talk about the next ring here, which is talking to your family. Siblings are always a big question. They have almost certainly been impacted by your child with special needs in some way, both positive and negative, by the way. But some siblings react by becoming caretakers. They are super tolerant and concerned about helping the child, sometimes to their own detriment, miss out on things because they're so busy taking care of the other child. Whereas others might be more embarrassed or antagonistic and end up with a pretty difficult relationship and some jealousy. So, your older kids probably already know that, even if they're not talking about it, they're probably aware of the problems that your child is having. Even if you've never had a diagnosis before, that you know, your little brother has a really hard time sitting still at the restaurant. And so you're always embarrassed when you go to restaurants, or maybe your family doesn't go to restaurants because they are just a holy terror when they're at a restaurant. So they've been impacted by this in some way, and they're aware of the difficulties that they're having. So again, we're putting language to things that they already know. Younger kids might not be as aware, even if they have been impacted, not as aware of it. But there are definitely ways of bringing them onto the team, onto the construction crew. And it is important to just continue to be developmentally appropriate in how you are talking about it. Using a similar explanation strategy for the way that you did with your child. What are the things that their siblings need to know? What are the ways that they can understand it? And what language can you use for that? The whole family can be brought onto the construction crew, but it's really important to help siblings to know that they are an important individual member of the family too. It is not just, you know, the Johnny show or the child who has the diagnosis. It is not, the rest of the family is not there just to be window dressing for the child. They have an important role. They have their own voice. They're just as important as others. So it's really important to keep communication lines open to and follow up this edict with not 100% pouring yourself into your child with special needs, and finding special time on a regular basis to share with each other member of the family, including your partner and yourself. Also very important. Now, should you tell your child's friends? That is something that really you should bring your child in to weigh in on that. Now we're expanding it now to talk about the community. Should you tell your child's friends? If the diagnosis has been normalized enough, hopefully it won't be a big deal for children to share it with their friends. They're just sharing aspects of things about themselves the same way that they might say my favorite color is green. But if they don't want to share that information, then you should do your best to respect their wishes. If they do want to tell, then you have a conversation about who's going to tell them and how is it going to go. There's a bunch of published activities out there for how to explain a diagnosis to a class, especially when it comes to a medical diagnosis or for autism. Carol Gray developed one in a program in 2002 called The Sixth Sense, about explaining autism to younger elementary school kids. And she puts social perception as a sixth sense alongside your other seeing, hearing, tasting senses, and talks about what it might be like to have a sense that is that has a little bit more trouble in some ways, similar to not being able to hear well. Maybe you can't perceive social cues well, and it's just another way of normalizing a different brain pattern. And there are a lot of books out there to help you explain diagnoses to your kids, to their siblings, to their friends. I actually have a handout with a lot of these different resources that I'm going to send out to everyone alongside the slides and the recording. I'll send out this handout as well. And then finally, let's finish talking about the community. You know, your kids' grandparents and extended family, their teachers and providers, other parents in your parenting group. You know, many of these same principles apply. You are normalizing it as much as possible. It's really, I would love to see a place where our society gets to understand that there is no like normal person. We all have different patterns of strengths and weaknesses, and this is this person's, and this is this person's, and this is this person's. So you can help by using that kind of language. You can describe the basics of the diagnosis and then the highways and the construction zones that go along with it. When she does these things, she is not being rude or stupid. Her brain is just wired to do X. And then you can give that person something to do to help, which in effect really brings them on to the construction crew. So for example, when Max melts down at the end of playground time, it's because he's so disappointed about leaving and doesn't know what to do with those big emotions. It's not because he's trying to manipulate you. You can help him by giving him lots of warnings ahead of time, talking about the good things that are coming up, and keeping calm and neutral if he melts down. And you have to remember that, like with your child, this is an ongoing conversation with all the members of the community too. As others in the community learn the nuances of your child's diagnosis and what it means for them in different situations, then they can also apply it for other people that they know who are also struggling with the same things. All right, and then lastly, let's talk about advocacy. So Again, my position is don't be afraid to talk about your child's diagnosis. You are setting the example that there's nothing wrong here, that there are just some differences that need to be acknowledged and defined, but it's nothing to hide. Because others do tend to default to thinking that there's something wrong with a child, the more that you can talk about how this is just the way that their brain is wired, the more you can break down that automatic assumption and help others to stay in this mindset of being curious and solving the problem instead of being closed-minded and judgmental. And then when should your child start advocating for themselves? I'd say right away. It's kind of a theme here. Even a young kid who says to their preschool teacher, I'm mad, I want to go to the calm down corner, that's a form of self-advocacy. And the more that kids can recognize what they need and learn to ask for it, the better the outcome. And you can always involve your kid in what it means to be a self-advocate, how much they want to do it versus how much they want you to do it, and how you can start to shift that ratio over time. Some kids will want that ownership early, and then some would rather just hide behind you and let you do it for a while. Around 8, kids might start to want forging their own way. At 9, maybe a little bit more. At 10, maybe they're starting to take the reins of their peers. But it's just a skill to build, just like the others. It's going to be different for each kid. How much they want to talk about it, how able they're able to talk about the nuances, that's going to be different. And you and their therapists and other providers can help them to recognize what they need and how to ask for it in a helpful way that is most likely to give them what they want. So screaming and throwing things, not helpful. Saying it in a calm voice before you start to get really upset about it, that's more helpful. You can teach them scripts, you can practice it through role play. It's just an important skill to learn gradually, which they will continue to need again and again throughout their life. So, as always, our clinicians, we at Small Brooklyn are here to help you with this. Obviously, we have the neuropsychological assessment arm, which is one very common way of receiving a diagnosis in the first place, learning about those highways and construction zones, communicating that information back to you as well as to other people in your child's life. Our therapists are also really adept at helping families to understand that, especially if they're coming in from another source or have never entered the mental health field before, and really helping you to understand what that means for you, specifically for your child and your family in this point in time in the pandemic, what's going to happen next and all of that. So please feel free to reach out to us anytime. And there we are again. And here's Jill. And I'd love to answer some questions.
All right, that was so helpful. Thank you.
Thanks.
We got such good questions. I'm really excited to jump in. So one of the biggest ones that we got, I think would be so helpful to address, how do we help children accept the people and the services that are on their construction crew? And how do we help them understand that this doesn't mean that there's something wrong with them, that it's services like medication, like therapy, school services? How can we help them begin to actually accept these services that they really need?
Yeah. So I think the first key is talking about the highways and construction zones as things that everybody experiences. These are my highways and construction zones. Here are your highways and construction zones. Here's your sister's highways and construction zones. You're normalizing it as much as possible. And then you're talking about how, because it's a construction zone, we are developing this and it is a work in progress, and everyone can get a little extra help to work on this skill. And just like if one of your construction zones was that your vision is a little blurry, we will go and get glasses so that you can see better. Well, if your construction zone is you are really impulsive and you have a really hard time stopping, and medication is something that can help with that, it's the same thing. And so being able to describe it that way, in a way that is very normalized, is not shameful, it's not stigmatizing, and really comparing it to other things that they've already seen in their lives as things that they have gotten help on before and have come out the other side and now can do it well, that can really be very powerful. then I think the second part of that, helping them to accept and maybe even be motivated to do these things, is again bringing it back to their own hopes and wishes for themselves. What are the things that they want to do that they can't do yet? And sometimes it takes a little bit to dig in to really get kids to verbalize these things. Sometimes it might be, I want my mom to stop yelling at me while I'm doing homework. Sometimes it might be, I want to make a ton of money and be rich and famous. But you can use those motivations to give the carrot, I guess, for, okay, let's map out, let's make a plan for how you're going to get to the place where your mom doesn't yell at you when you're doing your homework because you're not doing your homework. Here's 2 steps that will help you to get there. Now, this step is something that you can start doing right away, but this step, I think you need some adults to help you with that. And here's an adult who's going to help you to learn how to do that. And then you can get past that construction zone, will turn into a highway, and then you can try another construction project next.
I love that.
What do you think, Jill? Actually, I know that you...
I think that's perfect. I love the glasses analogy. I often will use that because we could squint. And it's not going to feel good.
I used to go like this before I got glasses in elementary school. Yeah, you could do that forever.
Too. And then I realized I had terrible vision. So I think it's really helpful to also break down some of the stigma that parents might feel. And that's always something I try to help parents do, because we all have stigma. That's, just part of the world. And so if we can break down how we're coming about it first and foremost when we're talking to our kids, I think it's really important.
Absolutely. I think that for parents, one of the things I tend to hear a lot is, what if I make this so easy for my child that they never really understand what it means to struggle and they don't build up those muscles as much, right? You probably hear this a lot too. And likening it to the physical, disability isn't the right word, but, like having problems physically and having a physical help for it, like glasses or like insulin for diabetes. Like I make a lot of analogies to those sorts of medical issues, which I think can help parents understand that. It's like, well, your child has cancer. You're not going to say, just try harder to not have cancer. That's one thing. But then also a lot of parents have, because so many of our mental health issues are genetic, a lot of parents have had the same sorts of struggles, and they remember what it was like when they were the kid that couldn't sit still and was annoying in class and couldn't read or whatever it was. And a lot of them struggled a lot and came out the other side and are now successful adults. And so they will say to me, I was able to do this. I didn't have medication. I didn't have they didn't even know what that was back then. So I would just want my kid to go through the same thing. And then I will say, but you had a lot of problems with depression and anxiety when you were a teen in the early 20s. And it's so awesome that you have overcome that and you're in a much better place now. But wouldn't it be great if we can help your kids to not have to suffer in that way? Yeah. And then I also have to, remind people that while they were a successful story, a lot of kids are not. And it's not that we don't want to scare anybody and we don't want to paint anything in a really negative light, but sometimes kids who never get the understanding and the support that they need do end up with entrenched problems that are really a lot harder to fix later.
Yeah. And I think it's also so dependent on peer relationships too. And so it's so helpful to make sure that kids know that their friends are going through issues. It may not be similar, it may not be exactly the same, but when kids feel self-conscious at school, for instance, because, well, so-and-so doesn't get pulled out or they get to test in the classroom, but I need to be in a separate location, just reminding kids, we might not be able to see every difference. And that doesn't always help, but it can be somewhat validating to their experience and their feelings and emotions around that.
I love that. I think it's a really important point that we can't always see what problems people are dealing with. And agree that when you have a peer, so especially somebody that you really respect, who is also experiencing problems, oh my gosh, it's really powerful for kids a lot of times. So again, that comes back to that normalizing conversation. Is the more that you can talk about it with your community, the more likely you are to even discover that these sorts of things are happening with people close to you that maybe they haven't felt comfortable talking about before.
Yeah.
In Brooklyn, oh, sorry. I
No,
was
go
just
ahead.
going to say that in Brooklyn, there's a group on groups.io and a Facebook group called Brooklyn Special Kids, which I have heard is quite a great community for people who are getting mutual support for kids with special needs. And I would imagine those are really great conversations that are happening there. So feel free to check those out if you are not. What were
Yeah,
you going to say?
absolutely. I was thinking too, it's so important if you can also help kids be able to identify peers that might be experiencing similar issues, or, support groups for kids, if there's any way, or even just a buddy or a pen pal, just if there's any way to, again, show them that they're not alone. And one really good question we got in the chat was, what if my child, and especially a teenager, what if they don't want to hear that people are suffering like them? What if they want these issues to feel like it's their own? And every time mom or dad try to validate, or a parent tries to validate, oh, this is normal, this is fine, everybody experiences this to some extent, the teen then pushes back.
Oh, that's so interesting.
Yeah.
I would be really curious to find out what the motivation there is. Is it just about feeling special and feeling that there's something that they're, kind of have a superhuman sort of experience? I'm not sure.
I think,
But
yeah, I
yeah, go
totally
ahead.
agree. I think it'd be so interesting too to just kind of peel apart the layers of that onion and think, kind of ask them like, well, what does anxiety
Totally.
mean to you? What does depression
Yeah,
mean to you? And again, validate, making sure that
totally.
they're validating their experiences and their feelings. And it's okay if it does feel different than what I'm explaining.
Yeah. And also to keep coming back to the fact that even though they are not alone and many other people are experiencing similar patterns, because we are so unique, there will always be something about that particular kid's situation that is different. So maybe that's a way of saying, yes, other people have problems controlling their anxiety, but you specifically are. And so you can talk about it in that way while still letting them know that there is a special and unique thing about them. What do you think?
No, I agree. Definitely. I think it's also very developmentally normal for kids to think, no, I'm special. This is just what's happening to me. Nobody else has experienced that. So again, trying
and
to
if they
do
feel
more.
good about it, as long as they're not feeling like, oh, that makes me a weirdo and like no one can possibly help me because no one experiences the same thing.
Exactly. And that's where the construction crew kind of comes back along.
I love that, don't you? I'm going to use it all the
I
time.
do. A good question we got a couple of times too is just how do we talk to kids when the larger issue is also a genetic disorder or another difference that is not necessarily a mental health difference and may not be best supported with therapy or medication? Is there any way to kind of tie in those larger issues to this type of conversation?
That's a fantastic question. I will say I don't have a ton of experience on medical issues. Some of our therapists do have a little bit more, so I'm definitely speaking off the cuff here, but I would say normalization is still a big part of that conversation. There are probably other children who are experiencing the same diagnosis. Finding community for those kids. There's lots of Facebook groups and they have meetups and virtual, Zoom meetings and things like that, which can be really helpful. Finding the strengths. So again, the highways, but also like a lot of difficulties also come with flip side abilities that maybe would not be as recognized if not for the disability. So not to oversimplify, but for example, like people who are blind have stronger hearing. People who are, who feel who have less opportunity to hang out with kids might be like super sensitive and able to and really empathic. There are almost always ways that you can find the strengths in the mental health disorders as well. They're like flip sides of each symptom. You can probably find those for the medical issues too. And then helping kids with medical diagnoses know that while this is something that they are struggling with and might not get better in the sense that their body is not going to spontaneously generate a way to produce insulin, regulate their insulin, that they have their construction crew to help, to give them support, and that, we'll do all of the services that we can to help them, medication and other sorts of, PT, physical therapy, that kind of thing.
Mhm.
I don't know. What do you think?
Yeah, no, I think that those are all great. I think finding a community and also validating the fact that kids are individual, even kids with genetic disorders don't all look
Totally.
exactly the same. Just like a kid with ADHD doesn't look the same as their peer.
Good point.
So I think individualizing it too, and then really working on the acceptance. And ideally, therapy could be helpful in those cases if a child is old enough.
I think so.
So I'm working on the acceptance, and again, changing what I can, focusing on what I can control and change in my environment.
Mm-hmm. And how do I manage it when I feel super anxious and maybe some depression builds up? What do I do about that? Therapy can be really helpful in that way.
Absolutely. And just one more quick question. So do you think that it is also helpful? So the sibling conversation was super helpful. Do you think that it's helpful to talk to siblings at the same time, or would you try to focus on having those conversations separate? So talking about the diagnoses with the child that just went through this long process of obtaining a diagnosis, and then talking to the sibling, or is it sometimes better as a family conversation?
My instinct is to say to give everybody separate space and time to talk about it. I would love to hear from people who do it differently, because I would like to understand that rationale. But my feeling is that each stakeholder in the family needs their individual space to be able to talk about their deep feelings about it, their thoughts, things they might be ashamed to say in front of other people in the family, and to feel secure and safe in doing that, and then to get some help to resolve some of that so that then they can bring it back to the family team and feel okay about it. Especially the kid themselves, I definitely feel like they need their own space to be able to do that. When it comes to the siblings, there's probably going to be some resentment that may have built up over time. And I would want the siblings to be able to have the space to say that without worrying about hurting the feelings of the other, the client. Yeah.
Yeah. And
would you do it differently?
No, I think it's really good to have those conversations separately. I think also you have to prepare in two different ways. I think visuals are always really helpful for younger children. Social stories can be helpful for very young siblings. So understanding what is going on, again, to the best of their ability in a ADHD brain, for instance, or how they can support their sibling. Also just thinking about how they can have that family conversation together, who the sibling can go to if they need a break or if they need to talk about it in a not so nice way, or they need to vent a little bit.
Right. And that they might not feel comfortable saying that to the kid themselves, but still need it. You mentioned social stories, and everyone might not know what that is. Can you describe what a social story is?
Yeah, definitely. So it's a story that we use with a lot of different types of kids, but ideally we are creating an individualized storybook, which is explaining anything. It can be as simple as, it's my first day of school. This is what the first day of school is going to look like. I'm going to walk over the door. I'm going to put my backpack on. I'm going to put my shoes on. I might feel a little worried. I might feel worried in my belly or my heart. So explaining things in that way. It could be more individualized towards, my brother has ADHD or my sister has ADHD. This is what ADHD is. These are some of his, again, highways. These are some of his construction zones. I might feel a lot of different ways about this, so exploring that. But it's really individualized to the kid. So, you can make those with therapists. We use them all the time just to help kids understand in a more individualized, beyond kind of a storybook type of way, but also just be able to, again, have some concrete item that they can take with them if they want to kind of explore more and learn more.
That's awesome. And I'm sure that we can use that for the individual child who's getting the diagnosis.
Exactly. Definitely.
Very cool. All right. we are out of time. So thanks so much for joining us today. I really appreciate your time. I am going to send this recording and the slides and the handout with all of the books and resources on it out to everybody. Please do come back to us next month on February 9th, where neuropsychologist Dr. Danielle DiPietro is going to talk about how to make sense of all the different kinds of evaluations that you can get out there and how to do all of that. Reach out to Small Brooklyn, to us here, if there's anything that we can do to support you. And thanks as always to Parksville parents for helping us to get the word out about our webinar series. Have a great rest of your day. Thanks so much.